Hey everyone, this is Balaji for Goddess Talk. Welcome. It is a wonderful Thursday in Tampa Bay. We're waiting for our guest to. She is here, but she had to quickly run out to get her coat because I got a doctor in the house, and she wanted to make sure on screen she looked as professional for y'all as she wanted to be. But here she is. See, she's right there. She wanted to make sure y'all saw her coat. You can't tell her nothing. I love her. All right, so Dr. Sampson is here. Dr. Marian. Dr. Marian Sampson. What's good, Dr. Sampson?
How are you?
All right, so what I want to make sure everybody gets an opportunity to do today with you especially is to ask all those questions that we may have as far as gynecology.
Correct.
So what is the title specifically? You are OBGYN / gynecologist. So talk to the mic.
Yeah, so
But welcome first.
Hi, thank you.
All right, so Dr. Sampson, where are you from?
I'm from Jackson, Mississippi.
Mississippi, and we have this thing about David Banner. So what's up, David Banner?
I know, right? Are you listening?
Oh,
yeah.
Look at her. She just tried it just now. So, Mr. Banner, if you single,
mingle.
Look. All right, so Dr. Sampson, you're from Mississippi. How was that growing up there?
My roots are definitely deep. I am that very southern person, very southern, belle to a fault sometimes. I absolutely love to cook, which means I love to eat. I cater to the special person in my life, whoever that might be.
Okay.
So I'm very southern when it comes to that.
Okay, so what brought you into the medical field?
Well, that's a convoluted little story. I was a teenage mom.
Okay.
I was pregnant at 18 in college, and the physician who took care of me, he never treated me any differently than he treated his married, female patients. So I just felt like that was a point of respect that even though I was on Medicaid, they may have had regular insurance, or may have even been cash pay. He never treated me any different, never made me feel less than a patient to be taken care of. So at that time, I was in college, a biology major, had aspirations of wanting to do medicine from the time I was a little girl, cutting down a tree in my dad's front yard because I wanted to know.
Down trees.
I cut down a tree because I wanted to know how old the tree was.
So you can see the little rings and stuff?
I had learned that in second grade, and my mom was able to save my hide that day. She was like, wait, don't hit her. Just ask her why she did it. I was 7 years old. And so from that time, I really had an interest in science and knowing, knowing how things work, understanding life. So it was a natural fit when I had the opportunity to go to medical school. So the way that came about was, like I said, teenage mom, got, through Jackson State. That was my alma mater. And once I graduated, I had actually gotten married to someone else, not the father of my child. And it was, to a point where I needed to work. He needed to go to school. So I began to teach. I was a science teacher for 8 years prior to going to medical school.
Oh, wow.
So I had the privilege of teaching at my former high school, Murrah High School. Shout out to MHS, Roll Blue, Mustangs. So I taught there for 6 years. And in a summer program in which I was able to take a student at Mississippi College, they started to post the signs for the MCAT for their students. Okay. And so I'm thinking, maybe I should see. Maybe I should see. Just on a summer program on a whim. $45. Won't hurt to take the test. They only gave it then in August and in April. Okay. So this was the April sitting. Took the test, did okay. But when you're 28, 29 years old and you're a mom, I had 2 kids at that time and was married, the schools don't look at you quite the same way. And being a woman of color. So being a woman, period. So I, talked with some people there at University Medical Center in Jackson, and they were like, you can improve your score, maybe, just maybe. So I actually found out 2 weeks after I took the MCAT that I was pregnant with my third. Okay. So I went on my first interview 7 months pregnant.
Wow.
Yeah. So he's 22 years old now. It's all worked out. Okay.
He was part of the process.
He
of
was
mommy
a part
getting here.
of the process, and we're gonna talk about that process. Yeah, you can't stop the process.
No, just because
you just have to be in it. Exactly. So, I looked at Marian Medical College a couple of years later, improved my score on my own, and that's it. Yeah.
And went right to being a OBGYN.
Yes.
So what is a OBGYN? Please put it down.
So OB are the first two letters of obstetrician. And obstetrician is someone who takes care of pregnancies.
Okay.
So taking care of the pregnant mother.
Okay.
We really don't take care of the baby.
Okay.
Because people are like, oh, my baby's born and my baby got a rash.
Yeah.
No, call a pediatrician. That's not me.
Okay.
Yeah. So obstetrician is for the care of the pregnant mother, and gynecology, GYN, the first three letters of the other part of our title, is just caring for women throughout their life. So starting from menstrual age or menstruating age, sometimes a little earlier depending on things that may be going on, all the way till she leaves.
Okay.
Yeah.
So you are a doctor at Gentle Hands OBGYN here in Tampa Bay, Florida.
Wesley Chapel.
In Wesley Chapel.
More specifically, yeah.
Yes, Wesley Chapel. And the way I found you is because your organization was part of a list that was provided to me, because I was like, I'm looking for a black gynecologist.
Okay.
And so I happened to look at it.
I didn't know I was on that list.
I don't think you were specifically. I think it was the other doctor.
Okay, Dr. Ashby.
Yes, and so I was like, all right, so I got on there and I saw both of you. I was like, oh, we have multiple.
Yeah,
so I happened to have you, and it was just great from that first day. And she's been so supportive of everything I've been doing, so it's been just wonderful getting to know you, not just within the, check this out. But you checked out all the other things she was actually at my event yesterday, so that was dope.
Yeah, and at the Gods and
Angels.
At
the Gods and Angels. Like, she's been back to back, and she came out
trying
with
to
them
buy
heels.
some water.
Look, she's about to buy some of that blue water. If y'all watching, we have the blue water, black on here in Tampa. Look, all right. So if y'all looking for blue water, follow.
And it's good.
Yeah, Blue Water CO on Instagram and Facebook. So now you are at Gentle Hands. What are some of the myths about gynecology or being an OBGYN or just in general of the field that you would like to dispel for us as black women?
Well, I don't know if they're necessarily myths unless they bring them to me.
Okay.
But there are things that I believe in that can be remedied ahead of time just by educating the patient.
Okay.
So just knowing the difference between a yeast infection and a bacterial infection or a UTI.
Okay.
Because patients will say, oh, I got a UTI. And then when they come, it has nothing to do with urine. It's like,
it doesn't hurt or those other symptoms.
Yeah.
Okay.
So just knowing the difference between one type of vaginitis to another to a urinary tract infection.
Okay.
So I usually just kind of break it down as simple as possible.
Okay.
If you think you have a urinary tract infection, you probably feel like you're peeing razor blades. Yeah.
It hurts.
It hurts.
Okay.
Yeah, that's a urinary tract infection. That's something that's affecting your bladder that could eventually go up the tract of the ureters and affect your kidneys, correct. Anything else that affects the vagina itself could be a variety of things, but it's vaginitis. So itis, of course, not our itis, but the other itis. The other itis means something's inflamed or irritated. So that could be a yeast infection. It could be bacterial vaginosis. It could even be an STD. And actually, a yeast infection would probably irritate you more than an STD.
Oh, wow.
So it's always a good idea to know the difference between those. It will help your physician a lot better in trying to assess you and get you taken care of.
Okay. So to go back, you mentioned with the yeast infections, the UTIs, are those common?
Pretty common, especially in sexually active women. And that's because the urethra, which is where we urinate from, is very close to the vagina. So if you're using your vagina and the urethra is close by, it's not hard to get a little bacteria in there, right? And then some women will be more prone than others. Certain habits, such as making sure wiping front to back, and that's kind of the teenagery stuff that you teach. And then you also want to make sure to empty the bladder after intercourse. Yes. So to keep
go to the bathroom right after, y'all.
Well, soon after. Cuddle time's important too.
You are the best. Look at her. talking about cuddle time. You know, lay there a little bit and then get up and go to the bathroom.
I got to get up right now.
But if y'all have any questions,
that's an excuse for him never to cuddle. That's not good.
Right. But if y'all have any questions for Dr. Sampson, make sure you're dropping it in the comment section. Okay. So we have you going on our Afro-Organics page and the Goddess Talk page.
I see.
All right. So yesterday, me and you were just chit chatting, and I was like, well, you know, I'm ready for you to, you know, eventually become ready for you to deliver my babies when I get to that. And you were like, yeah. And I was like, yeah, and I want to do it at home. And you was like,
no.
I was like, what? You know, I'm trying to get back to the original way of us doing this and doing that. And you went through this whole explanation, not saying that dissuaded me from doing it, but I want you, from your professional opinion and just, you know, also being a black woman,
right.
Why would you caution someone from, you know, home births specifically? Why would you caution someone from that?
So one of the examples that I like to use is my grandmother. So my grandmother had 6 kids. My father was the youngest, and she gave birth to him at home. She was out in the field picking whatever it is she picks when she went into labor, and she went to the house, gave birth, delivered her placenta, wrapped him up, and went back out to work. But that's a woman who worked like that every single day. We don't work like that anymore. So when you're talking about what condition our bodies are in, what diet we're exposed to, and things of that nature, it's a different world. It's a different body. And not to say that a home birth can't be fulfilling and enjoyable and things of that nature, but black women or women of color in general are already at an increased risk of negative complications or even a higher risk of morbidity, which is death. Even when you have good medical care, even when you have good insurance, there's something that transpires in the same hospital setting that does not take place with non-black or non women who are not of color. Okay. So I want everyone to take the most precautions that you possibly can. Okay. And have the baby in a hospital setting if possible. I have had patients to elect for a midwife birth, which is absolutely fine. The one patient that I recall specifically, first baby, I did her ultrasound late in the pregnancy. The baby was not too large, excuse me, and I told her, you know, you're probably gonna be okay. However, whoever your midwife is, you need to know who her physician backup is, because all babies don't adhere to your birth plan. Oh,
we'll talk about the birth plans in a second, because that is another thing. I had a doula here a couple episodes ago, and, you know, talking about the birth plan, but we'll come back to that, so keep going.
Yeah, so just keep in mind your body does what it does, and you want to make sure that you're as healthy as possible. So I try to get patients to understand, even when they come into the hospital for an induction or just, you know, spontaneous labor, even of any vaginal delivery can become a cesarean delivery. We have no control over that. There's no amount of planning that can really prevent that. It's just one of those things you have to wait and see. So previously, you know, the cave woman didn't have a cesarean as her option. So a lot of us died. A lot of the babies died. And even when you talk with some of your family members, they may not, you know, you just remember, oh, auntie so-and-so had 6 kids or had 10 kids. Yeah, but they're not really telling you about those that died.
Yeah, those babies that died.
They're not, and they tend to not disclose that history to you, you know, for whatever reasons. So I would say, do your homework. It's not that you can't do it. You just want to make sure you have that physician backup and that you're already safe as possible to do it. So that patient was very successful, but she chose to have her next baby at a hospital. She said, I'm done with that part.
Okay, so what do you say to those people who talk about, you know, the high cost of medical care these days? Like, there are some doctors, not you specifically, but others who are literally, they're pushing you towards C-sections or pushing you towards these things that are becoming exorbitant with the prices. So why would I put myself, my family, in that kind of debt because I am having a baby, when I could elect to have it at home and probably save on 90+% of the cost?
You may save on it, you may not, because the cost of the prenatal care is is important.
Okay.
So making sure that you have your proper labs, whatever fees you are paying for your vaginal delivery. The hospital costs, they can get to be pretty exorbitant, especially with the state of Medicare, Medicaid, and you have patients who are uninsured. So we all kind of end up absorbing those costs. Those of us who aren't having kids we end up absorbing those costs.
Okay.
However, I would say, in short, you probably get what you pay for.
Okay. So whether you choose to or not to, it's up to you. So we're about to take our first break. When we come back, we're going to answer some of these questions. Make sure you call 813-444-9588 if you want to get in on this conversation and ask some questions. We'll be right back. I was giving my business line. I was like 844-416. I was like, hold on, what's the number? All right, so I'm going to answer this. We're going to ask these questions when we get back, y'all. But make sure you keep dropping the questions in the comments. We appreciate y'all. I'm trying to remember what other questions I had.
You already have your Janet Jackson question.
You see, that's on the other phone, so I'm going to write it over here because I want to make sure I do not forget that.
Yeah, I knew I was going to blow you out the water with my grandma.
No, you didn't.
Well,
because, again, my family's Nigerian, so a lot of stuff that seems old here is still happening.
It is.
In my culture. You see what I'm saying? So that's why I'm like,
But you get in that car and you drive, you're not walking everywhere.
But I'm not saying that. I'm saying as far as the story.
In general.
Like, the story is actually pretty
no, I'm not saying that. I'm just saying, like, now, it's not the normal around here.
Look, my mom, and this is the thing, I pray for the strength of my mother. That's what I say when I'm like, when people are like, okay, so what do you want? What do you want? I was like, look, I just want healthy babies.
You built for that already.
Because I'm like, look, I just want the strength of my mother. Because number one, she did with no epidurals. She had 4 of us big ass babies. I'm sorry.
You don't have to do it after epidural, but if you want to, that's fine.
But she had 4 of us.
I have pretty good advice on that too.
Yeah, so it's like that's all I think my prayer and meditation has always been. It's just like I want the strength because she was in literally full labor and she just popped us right out, and she did not want to stay in the hospital more than a day, barely. But they would force her to stay.
Well, on the first baby we do.
But that was in Nigeria. I was born in Nigeria, right?
Oh, okay.
And so the issue at that time, when she was having me, was people were stealing babies.
Oh,
so the fact is that because one of her best friends was a nurse, that's the only reason she said she would stay. Yeah. Okay. And I'll tell about that story because that was a fear of hers.
Wow.
So she didn't want to stay.
You wanted to leave.
No, she did not.
And see, now everybody stays in the same room.
Yes. Hey, y'all, we are back on Goddess Talk with Dr. Marian Sampson of Gentle Hands OBGYN. What's good, Dr. Sampson?
Everything good in the hood, baby.
All right, so before we went on break, we did have a couple questions I'm going to ask you or just ask your opinion on it, okay? Sure. So let me pull this up so I can read it properly. What makes it difficult for women to have vaginal births after cesareans, or are there any difficulties or hardships at all after having a cesarean first pregnancy?
Okay, so it's not really the hardship necessarily. It's an increased risk of what we call uterine rupture. So that's where when we make the incision in the uterus to actually get the baby out, we have to put that back together. So that scar, no scar on your body is as strong as the native tissue. Okay. So if you can imagine, now you have a scarred area and the uterus is going to grow again, and now you're asking the uterus to contract and squeeze and pull on that scarred area. So there's a risk that it could
rupture again.
Open. Okay. It would open on its own, and now you only have the amniotic sac between the baby and the inside of your body.
Oh, wow.
So that could be a bleeding risk for you, bleeding risk for the baby, and it's just a higher mortality rate. Okay. Although the quoted rate of uterine rupture is only about 1 to 2%, that's still increased because you have a healed scar. Okay. So we do recommend 2 years from the birth of that child before even putting another baby in there. Oh, okay. So I make it really vivid for patients. I say, when this one blows the candles out on the cake at 2, you can make the next baby.
Okay. Wow.
Not they need to be 2 years apart. Okay. Like they need to be 2 years and 9-10 months apart.
Okay. So what are your thoughts on natural remedies such as V-steams, vaginal steams, inserts like boric acid, etc.? are those essentially healthy or harmless?
Okay, so boric acid is something that we do prescribe and recommend to try to maintain vaginal pH. It's a pretty simple chemistry that goes with the vagina.
Okay.
The vaginal pH stays in an acidic range. It's not super acidic.
Yeah.
You know, of course, because you don't just get burned when you touch yourself.
Yeah.
But it's you have an acidic pH, and you want to try to maintain that. Everything we expose it to, however, soap, semen, laundry detergent, almost everything else is in the basic pH range. So the boric acid is to help maintain the pH. Things like the vaginal steam. I would say, would you steam your mouth? Because the vaginal tissue is very similar mucosa to your mouth. So you don't really have a need to steam your mouth to clean it. You just brush your teeth and it does the rest. Now, we're not talking about brushing the vagina. However, it does have its own natural process
to clean itself.
Exactly.
Because when I was younger, I just remember this one story that they said, your vagina is basically a self-cleaning oven. And so you don't need to put nothing in there because everything that needs to will always flush itself out.
And that also has to go along with drinking enough water every day.
Yes.
That again, we have to do the lifestyle things that come with it. You can't expose your body to all of these negative things and expect it to be okay.
Okay. So talking about, drinking enough water, because I drink at least 1 gallon. Like, you see all these blue water here? Okay, I know that at least 1 gallon is about 7 to 8 bottles.
Which is 128 ounces.
And I get through all that, if not half the day, but I drink a lot of water. And a lot of people don't. People are drinking sodas like it's nothing. They're drinking all these fruit drinks, or they're getting water and putting like Crystal Light and all those things in it. You need to drink water.
Your body can't use that.
Yes.
So even if you drink the gallon of water a day, let's say you add 8 ounces of coffee or whatever. Now you need to add 8 more ounces of water.
Okay. You need to balance it out.
Yes.
And drink fruits and vegetables, of course. All those things are very important. It's not just the water. Yes.
And I'm not big on artificial things.
Yes.
So if something has an artificial color, if you're going to drink a soda, drink a Sprite. Something you can clearly see through. Something that doesn't have colors to it.
Okay.
If you are going to do, I don't even like to say Crystal Light and things of that nature for weight loss. Because what happens is your body doesn't know what to do with the artificial part of the artificial type of sugar. So it's a very simple premise to follow. If the ants won't eat it, you probably shouldn't eat it either.
Doctor, I got a question for you, Dr. Sampson.
Hi.
DJ CEO here. I know you didn't expect it.
Yeah,
sure I did.
What's different from women of today than women of yesteryear who had children, like my mom, every year, every year and a half, versus what you're recommending now, 2.5 years before that?
Well, and that's the surgery part.
The cesarean section.
To allow for the scar to heal as well as possible, to try to reduce that risk of uterine rupture. Also, our nutrition is not quite the same as it was at that time. We grew a lot of our vegetables. We knew that things did not contain pesticides. A lot of things were more natural and wholesome. Even the methods of cooking. Cast iron helps to prevent anemia because you're absorbing iron. Everybody uses, something that's coated and all this kind of stuff now. So, anemia itself can be remedied more by, not completely remedied. Don't let me. Somebody.
Don't quote her.
I know
quote her,
somebody. Somebody be on TV talk about. She said no. But iron can be absorbed into your foods that way, as opposed to using things like aluminum. So when you look at the diet, when you look at the overall lifestyle, we're not as physical as we were then. We're actually having to make time to go exercise. That's not something that our grandparents did. That was a part of daily life. Walking the majority of places where you had to go. Picking vegetables. Pulling things. Actually, wringing your laundry.
Scrubbing it.
Well,
all those things.
Right. All of those things they added up. But now you go in, you push a button, laundry's done. You know, you can even do it from your phone.
Yeah.
If you have that little smart app thing.
Yeah.
So your thumbs are getting lots of work. The rest of you not so much.
Okay.
So when you're looking at women having kids every other year, also that had to do with the home structure too. And I'm not advocating either or. A lot of us in our society really do need to work. But if you had someone who the husband worked, or that was a part of the job, his mom was home and she did all of these other things, and yeah, she was home to keep kids for every other year.
Yeah.
Yeah.
Okay.
And they had kids younger too.
Yeah. So the next one, what should a woman do when she is ready to conceive or preparing to conceive? How soon should she get off birth control?
Yay.
This is
that's
a
my
huge
favorite
question. Great question. Great question.
That is my favorite question.
All right, so because I feel like that's gonna segue me into other questions that I got. Cause it got questions.
So one of my personal favorite tenets is preconception counseling. So many times people come in and they're like already pregnant. And I'm like, you missed the opportunity to do a lot of things on the front end. So preconception counseling, about 3 months prior to wanting to try, we do want you to start to take prenatal vitamins. The prenatal vitamins are not for the baby. They're for mom, because you have to build a person in your body using the calcium from your teeth, the calcium from your bones. You have to use the iron from your blood cells in order to build this person. So you're the Build-A-Bear store with this little Yoda in there. See how I threw that in? The
Yoda.
Yeah.
That was the cutest thing. I have still not watched it, but I was like, oh, that's so cute.
Yeah, I haven't seen it.
Yeah.
But yeah, you have to build a person within your body. So having the nutritional stores makes a huge difference in making sure that you're not depleted. So that came into another question that I wanted to address about
age.
About age and patients delaying childbirth until a certain age. So and then they want to crunch a bunch of babies all into a few years. So you really don't have time to replenish your nutrient stores. Right. And then you're left with your, like, why do I feel like I gotta go to the dentist? My teeth are, hurting, falling out. Yeah. You end up with all those things. Low iron, extremely low iron, which is a strain on your heart. May end up anemic to the point to requiring a blood transfusion. So being in the best health possible, thank you for that question, prior to getting pregnant is the best thing ever. So 3 months of prenatal vitamins prior. Also, if it's a first baby and you're not aware of your blood type, we would like to at least have you come in and find out if your blood type is a positive blood type, or if the rhesus, the Rh antigen, is present in your blood. So if you're a positive blood type, then you don't have any issues. It's present. You don't have to get what's called ROGAM. If you're a negative blood type, which means it's absent, the overwhelming number in the population, which it's positive.
Okay.
The father may be positive.
Okay.
So if mom does not have the antibody, the baby does. Now her body gets exposed to that. Her body will actually form a negative reaction against it. Not so dangerous for the current pregnancy, but it's like getting a flu shot. It's like a little bit of stuff right now, but when it sees the real thing next time, now that pregnancy is greatly at risk. Exactly. Okay. We can also test for your immunity to German measles and chickenpox. And there's a full array of things to check for in terms of your genetic carrier
sickle
status.
Cell, something I want to talk about, because
your sickle cell carrier status.
I'm a sickle cell trait.
Exactly.
And my mom, growing up, she was like, "You can't get with anybody with sickle cell traits." She was like adamant, and I'm 18, like. What does that have to do with anything?
It has a lot to do with
But I had a friend we lost, a couple years ago, and that was like, oh wow, this is something that, because like T-Boz from TLC, you know what I'm saying, and it's just like, wow, are you serious? So this could really happen.
So we do talk to patients about their carrier status and try to look at it from that perspective. So if you're a carrier, you obviously don't have the disease, but you have two genes. So you have one normal and one carrier. So if your partner also has one normal and one not, and you each gonna kind of roll the dice each time, you have a 25% chance per pregnancy of having a child who has the full disease. 50% chance of the child having a trait, and then 25% chance of the child having just totally normal genes.
And the thing is, my mom, I believe, had the trait. My dad does not. Right?
She has to if you got it.
And so it's like 3 of us out of 4. You know, like one has it not at all. But the other ones, we all have the trait.
Yeah.
You know, and it's just like, wow, that's something to think about. And then when I was a kid, I always used to study different things like Tay-Sachs disease. Yeah. All these things are
cystic
really
fibrosis.
Yes, all these things are things that affect children, and you don't know because you just want to. You're love. You want to have kids.
Want a baby.
And my thing is, of course, like you said, prevention, or thinking about it.
Preconception counseling is so important.
That's something I'll know for sure. I definitely would like to do that. I hope everybody else would,
Yeah.
But it's a whole situation.
While you're looking, doctor, what about the man? Is it important to get the blood type of the man to see if they're a match?
No, not necessarily. I understand where you're going with that, but it is important if we know that the mom, let's say if we confirm she's negative, we can also test the dad, and if he's also negative, then they're good.
Okay.
Now we have to prove he's dead. Yeah, that's okay.
All right.
and I say that from a medical perspective because it happens.
All right.
But if the father is negative, then no, they have no concerns with a mismatch between mom and the baby. But what we're discussing with the sickle cell trait, yes. So any carrier genes that show up positive in the mom, we do recommend father and baby testing. And the majority of the companies that we use, the labs we use, the dad can have his labs tested right through us. He doesn't even have to go out to his doctor.
Okay, so we're about to take our next break because we there. And we're speeding right through. So if you guys want to call in, be part of the conversation, please keep asking these questions. These are wonderful questions. We'll be back 813-444-9588. This is Goddess Talk on In Touch. These are great questions.
Thank you.
These are great questions.
Yeah, I did a radio show in Belglade every 2-3 weeks.
Yeah.
But it was kind of like the lady would just ask the questions. Little white lady, she just asked the questions. Yeah, that was it.
No, but these are questions from us as people. And this is why we do what we do.
But I love preconception counseling. Like, don't just show up pregnant.
Yeah.
Come on and let's get this thing
I'm
on the front end.
I'm not showing up pregnant then. We ain't gonna show her pregnant.
Whatever. You gonna worry me to death the whole time you are.
I'm gonna have all 3 of my daughters listen to this show.
Oh.
I'm so serious.
He got a couple. He's on look.
Please. If I was a little skinnier, I could be on TV, but too chunky for TV.
What you talking about? You're on Goddess Talk right now?
No. I'm talking about, like NBC and all that. They want you to
when I have my own TV station, they won't come?
That's right.
Cool. Let's go. I would have lost some pounds by then. I'll be ready then.
You can like,
we'll have locks down there. We'll be good. But no, I'm very passionate about all that I do, but definitely that preconception.
Yeah.
Because you can head off so many problems.
5 seconds, y'all.
Okay. That was a quick break because we kept going at one point. All right. All right, y'all, we are back on Goddess Talk with Balaji. We are answering some wonderful questions. Please keep asking these questions, dropping them in the comments section, or if you want to call in, 813-444-9588. So, next question, Dr. Sampson.
Yes.
All right, we got, what age is considered mature pregnancy? And this goes into what we were definitely hoping to get into. And I'm just going to give a background on what I said first, right? So a friend of mine, newly pregnant, love her to death, but she was surprised when they told her that she is considered geriatric. And I was like, hold up, we are not old. But apparently 35 and older is geriatric. My mom had my brother at 36, I believe. And that was considered high risk at that time. And I'm like, hold up, we're not that old. But now what's your professional?
But you are.
Look, I don't feel old.
So actually the American Medical Association, who does all of these coding and things for us, they term any woman who is 35 at the age at the time of delivery. So she could be 34 and pregnant, but at the time of delivery she's 35. She is an elderly gravida.
Gravida.
Gravida just means pregnant.
Okay.
You know what elderly means.
Yeah, I know that part. But that's a medical term.
And the reason
so geriatric, why they throw her at the...
Well, they were being nice to her. They called her geriatric. The actual term is elderly. We typically lump it and say advanced maternal age. We're just trying to be nice about it.
Geriatric sounded so rude to me. I was like, elderly, okay. But geriatric, because I work with people with disabilities. I work with people with, you know, all that. And it's like geriatric, it's like, I feel like you're, not saying you're a hospice, but, you know, you're old.
Yeah,
but
she's geriatric, sorry.
All right,
so the reason is before you're born, when you're about 5 months old, in utero, still inside your mom, all of your eggs are developed and mature. So your eggs are about 4 to 5 months older than you are. So unlike men, they don't develop any sperm at all until puberty. All of your eggs are
you have all of them
there
when
you're born, and then they just kind of do the second part of their division phase, and then they get released per month starting with menstruation. However, that DNA is still just as old. So the risks increase, not necessarily too much for things like Down syndrome and genetic things for the baby. There is a slight increased risk. However, the risk increased for the mother to be pregnant for the first time after an advanced age. So your risk of preeclampsia, which some people call it toxemia, preeclampsia, gestational diabetes, gestational hypertension, all of those things increase because your body is really going through this for the first time. So I tell patients overall, if you're going to give me a high-risk patient, I'll take a 16-year-old over a 46-year-old any day, because the 16-year-old is going to bounce back. Society, yes, we need to, not have teenage pregnancies. We need to make sure people are mature and ready and in stable relationships before they, bring families out. However, biologically, they're more equipped than on the other end. There's a reason we run out of eggs, and it's called menopause. We run out because you shouldn't be using them anymore.
And so we were talking, and you said Janet Jackson.
Oh yeah.
So what triggered that specific comment?
I have patients now who are in their 30s, and I bring up, I see on their chart, I'm like, okay, no birth control, but no pregnancies either. What are our plans? They're like, never. I'm like, never? Oh, or maybe when I'm, in another 5 years. I'm like, well, another 5 years, you're a much higher risk patient. Oh, well, Janet Jackson did it.
Because we're using examples.
So if it's a spontaneous pregnancy, which can happen as long as you're still having regular periods, or even irregular periods, going through the change of life, menopause on average happens around age 51. When you just run out of eggs, no more periods, that's the average age. Some younger, some older, of course. However, if you're going to do an in vitro fertilization or things of that nature, the age of the patient's eggs really does matter, and it's very unlikely that any reproductive endocrinologist is going to use a 50-year-old's eggs. So it's very unlikely that would be biologically your child.
Okay, so that just triggered two questions for me, because now everybody is going through, trying to get pregnant. Some people, they're getting eggs from other people and impregnating themselves.
Well, they're getting sperm usually.
Okay.
Yeah, they're getting sperm, which is called IUI.
Okay.
Intrauterine Insemination.
Okay.
So there may be a problem with the vaginal pH or something along that line, or the patients, you may have a same-sex female couple, and they're able to purchase a sperm sample and then have it just inserted. So that means there's usually nothing wrong with the candidate, the female, the woman who wants to get pregnant. So she does ovulate, she does have periods, and it's confirmed that her tubes are open. We can do that through certain types of ultrasounds and things to make sure that the tubes are open. So they're really just giving a dose of sperm and hoping that it finds its way to the egg on time.
Okay, and now the second question was menopause. Menopause is basically you have no more eggs and you just stop having periods. That's it.
stop having it. Oh, it's more than that.
Okay. No, I'm just saying, but that's usually the cycle that it's
but
caused.
hot flashes, night sweats, loss of the estrogen.
But the biological part
is
no
that the eggs have run out from the ovaries, correct.
Wow. I didn't know that. I just thought, okay, not saying I've been wishing this on myself, but I'm sorry, like, look, these periods for all these years, I'm like, oh my God, I'm tired of this. Not saying I was like, yeah, I'm ready for menopause.
It's about 400 periods. That's about it. You good.
Whatever. All right, so the next question.
If you think average 12 is a year, so if you take, let's just say 10, it's really 13 because it's 13 full moons. But if you average 10 a year for like 40 years.
I love that you said full moons.
Yeah,
go ahead.
Moons. Yeah.
Yo, my doctor is into all of it. Okay. All right. So, what are your thoughts on about smoking marijuana? Does it reduce nausea while pregnant, and what are the negative effects, if any?
Oh, right. So, yeah, it can reduce nausea in pregnancy.
Okay.
But also, drinking, all of that stuff can